knew that I would not. I feel good.
Santa Clarita's hometown station, AM 1220 KHTS. This is the Prima Pediatrics Healthcare Hour.
So good.
PrimaPediatrics.net for more information, or you can give them a call at 424-9000. Easy phone number, by the way, 424-9000.
We picked it for that reason.
Nice, simple phone number, easy to remember. PrimaPediatrics.net, of course. We're talking with Dr. Feldman of Prima Pediatrics, and she's the head honcho over there. And we're talking about stomach flu. And we talked a little bit about how you need to handle your kid's diet. And I wanted to ask you, how long can parents usually expect how long do they, if you have the stomach flu, how long do they vomit for until, like, it stops? Does it depend?
It depends on which virus they've got.
Okay.
But in general, the worst of it is over in the first 24 hours.
Okay.
If it's still going hot and heavy after 24 hours, you got to be going to the doctor.
Okay, gotcha.
But usually anywhere from 6 to 24 hours. Not that they're going to stop vomiting permanently after that, but the frequency is going to decrease significantly. And that's when usually the poop comes in, you know.
Yeah, and that's what I was going to say. My daughter, when she vomited for about, I want to say about, it wasn't as 24 hours, but she did for a day. I mean, she was vomiting, and then afterwards it was diarrhea after that.
Exactly. And that's to be expected. Now, there's a couple things you need to know. There are a few things once you hit the diarrheal component of it. Oh, and before we go to that, let me mention two things that are home remedies that you can do that sometimes will help with the puking.
Oh, fantastic.
One of the things is, and of course you can't do this in a child under a year, but over a year, you can get oil of peppermint. You can get these in the little health food stores, tiny little vials of
oil of peppermint. Okay.
Yeah, now the kids are going to freak about it because it burns a bit.
Oh, nice.
But a single drop under the tongue followed by some water will often quell the nausea significantly.
Oh.
The other thing that sometimes really works well for that is ginger tea, but only if you don't get nauseated from drinking ginger tea.
If you're not sick and you get nauseated from it, you probably shouldn't use it to get unnauseated. Gotcha.
Yeah, but
Gotcha.
Those are the two things that actually do work fairly well for nausea. The other thing is Coke syrup. And people always ask me this. Now, I'm not supposed to say you can use flat Coke or flat 7-Up, but everybody does.
Yeah.
There's a reason to use it, especially Coke. Not so much 7-Up, although the Coke is not so bad, because both of those contain sodium and potassium, which is what you're losing in your poop.
Oh, okay.
And because they're carbonated, they contain bicarbonate, which is the other thing you're losing. So... But how do you get it to go flat? Oh, yeah, you leave it stand open for 24 hours. Well, you don't have 24 hours. Easy. Take regular Coke, not Diet Coke, regular Coke.
Okay.
And you pour 4 ounces into a glass that's oven-proof, microwave-proof. Stick it in the microwave on high for 2 minutes.
Really?
It'll boil.
Wow.
And when you take it out, make sure you use a pot holder.
Yeah.
And then put a couple ice cubes into it. It's immediately flat.
Oh.
And it's immediately diluted to exactly what you want it to be.
Oh, nice.
So you get the combination of Coke syrup
okay.
along with some hydration.
Huh.
Now, is it the preferred thing? No, you're supposed to use Pedialyte. On the other hand, your kid may not be drinking the Pedialyte. They may want only the Coke. If that's the case, do what you need to do.
Yeah.
The one thing you shouldn't do...
All is fair in love and war.
Yeah, don't give them only water without anything else in it. My favorite story is is pediatrician friends of mine. Mom and dad, both pediatricians, and their kid had to be admitted to the hospital for hyponatremia because she dropped her serum sodium because all they gave her was water when she puked.
That's funny.
So you got to be a little on the careful side. Yeah. Not straight water. You can give them some water, sure, of course. You want to give fluids. But you got to give sodium, potassium, and bicarbonate of soda.
Okay.
So that's the thing. The old-fashioned way is you take baking soda and put it into a glass of water, a teaspoon of baking soda in a glass of water. It's disgusting tasting.
I was going to say. Okay, so those are some home remedies. That's good stuff. I like that. That's cool.
The next home remedy, it's not so much a home remedy, but it sort of is. Once the kids are over the worst of it, but they're still having the diarrhea, this usually lasts, depending on whether it's the double whammy or the single whammy.
Yeah.
The single whammies last anywhere from 24 hours up to about 3 to 5 days.
Okay.
The average is 3 to 5 days. By 5 days out, they're pretty much okay. if there's a double whammy, then you got to figure 3 days, better for 1 day, and then another 3 days. And sometimes the double whammy gets you longer. They still poop a lot for at least another week afterwards because it's kind of wiped out their enzymes. But as long as they're able to eat and they look well and they don't act like they're nauseated and etc., it's okay. You just have to go running after them with a bucket for their diapers. It happens. Yeah. But the other thing you can do, and that really helps, is to give them probiotics. Now, probiotics are the bacteria that you normally carry in your gut that keeps everything in balance. And when you get stomach flu, the virus just knocks that out. It upsets the balance. So 3 things happen. Number 1, you no longer have the good bacteria that help you digest food. Number 2, so getting back into eating again is kind of tough.
Okay.
Number 2, it allows yeast to overgrow. And I don't know if you've ever had a baby, get in diapers with the stomach flu. Their bottoms are fiery red.
Yeah.
For 2 reasons. Number 1, because often they'll have yeast.
Yeah.
And often they'll have scalded skin because the stool is so acid.
Yeah.
What do you do for that? Easy. There's 3 home remedies that work beautifully. You don't even have to call your doctor. If you think it might be yeast, then it won't hurt them if it's not. In addition to giving them the probiotics, and you have to ask your pharmacist for what probiotics. The most common ones are Biogia, Florastore for kids. There's a whole bunch of them. Just ask the pharmacist for probiotics.
They'll know. Probiotics.
Yeah. In addition to that, what you do is for their poor sore butts, it's easy. Number 1, you get some of the over-the-counter yeast creams, vaginal yeast creams for women.
Okay.
And instead of putting it inside, you just take the cream and you slather it all over the bottom wherever it's red.
Okay.
After you've cleaned it off. And don't use diaper wipes. They hurt. They burn.
Yeah.
If your kid's got diarrhea and all that, just, blot it off the best you can with tissues and run them under warm water.
Oh, okay.
That's the best way to do it.
I didn't know that.
Yeah. It's soothing, and then you blot that dry, and then you put your yeast cream on, and then you cover that with Mylanta.
Mylanta?
Yeah.
Holy Mylanta.
It's, and it's even better if you let the Mylanta sit so that the heavy stuff goes to the bottom, yet becomes like a paste.
Okay.
Take some of those popsicle sticks, take the paste out, and paint the butt with it.
Really?
Yeah, because it's alkaline. It completely counteracts all the acid.
Huh.
And then, if you want a barrier on top of it, as long as your kid's not allergic to eggs, you can actually use old-fashioned egg whites.
Really?
Paint the egg whites on top of it and seal it all in. It's disgusting, but let me tell you, it works like a gangbusters.
Okay, all right.
If you have kids possibly allergic to eggs, or the thought of putting egg whites on your kid's butt just gets you, forget it. Plain old Vaseline, petroleum jelly, or Andy ointment, and slather it on like a second diaper all the way up into the butt crack.
Oh, okay.
Because that's what you're trying to protect from the acid stool that's going to come out.
Okay.
So that's the way to handle it.
Yeah. There you have it. Some home remedies.
Yeah, and you know what? This stuff works. They call them grandmother stories for a reason.
And your parents survived, so grandma's stories works. You know what I mean?
A lot of grandma stories, even though they're not true anymore, were true for the time. Like don't let the baby stand up because they'll become bow-legged. Did you ever hear that one?
I did. Yes, I did hear that one.
Well, there's a reason for that, because in the old days, before we had vitamin D enrichment, there was vitamin D deficiency rickets. If you let the kids stand up too soon, they had rickety bones, and they got pathologic fractures and became bow-legged from that.
Look at that. Wow. Grandma. Don't ever speak ill of Grandma. Grandma knows best, right?
Grandma does
If
know.
your grandkids are listening, Grandma knows best. All right. We're going to wrap this up with the Prima Pediatrics Healthcare Hour coming up. We're going to wrap it up coming up next.
This is Jen Gerard from Whitening Lightning. Our flagship product, the Super Booster Teeth Whitening Pen, is a revolutionary breakthrough in professional-grade home teeth whitening. Our teeth whitening pens and professional teeth whitening home kits allow users to whiten their teeth and get the results they want when they want. No hassle, no messy trays, and no tooth sensitivity. Get up to 10 shades whiter in just 10 days. Look for the Super Booster Whitening Pen by Whitening Lightning in the little black box. Go to whiteninglightning.com.
It's painful when your teenager and your household is out of control. Out of control behavior is your teen's way of telling you something is wrong. Sometimes the reasons for their out of control behavior are so personal and tragic, your teen would never tell you or anyone else about them, but their actions speak louder than words. If your teen is suddenly exhibiting out of control behavior and hanging out with the wrong crowd, there is something you can do. There is hope. Action Parent and Teen Support meetings meet at Canyon High every Tuesday, 7 to 9 p.m. They work with teen anger, defiance, rebellion, truancy, and drug and alcohol problems. And meetings are free. Give them a call. Their counselors can help. Call 297-8691 or 1-800-4TEEN. That's 297-8691 or 1-800-4TEEN. Action. They can help.
KHTS. I feel good. I knew that I would not.
Santa Clarita's hometown station, AM 1220 KHTS.
I knew that I would not.
Prima Pediatrics Healthcare Hour.
So good.
Dr. Feldman, you go to primapediatrics.net for more information or give them a call, 424-9000. And we've been talking all things stomach flu and just how to help you if your kids are dealing with that and how if you're dealing with that. So, good show. I'm feeling good. I feel like, has there been a lot of stomach flu
We've been
stuff?
Inundated.
Okay.
Oh, yeah.
Okay,
Lots
so
and lots
helpful.
and lots of
So
them.
helpful here in on the Prima Pediatrics Healthcare Hour. We're always helpful, though. Let's be real.
That's the way KHDS is.
Yeah.
It's a community station.
And you wanted to talk about though the stuff that you
Looks like stomach flu, but ain't.
Yeah, so there are things that we talked a little bit about this earlier,
Right.
But what are some of the things that
Well,
mask
you know,
itself as
that mask of stomach flu? Of course, everybody thinks first thing of is appendicitis.
Oh, okay.
So can you tell if a kid's got appendicitis and not just stomach flu?
How young can appendicitis come up?
I've seen it as young as a year and a half.
No
when
kidding.
It hits in a year and a half, you usually blow it.
Whew, man.
Because it's very difficult to diagnose.
I believe it. I mean,
and a lot of kids, the younger they are, the more likely they are to present with diarrhea. And then the older kid, any kid over 4 or 5, and an adult with appendicitis is going to be the opposite. They're not going to poop.
okay.
But in little kids, they do.
Oh.
And so that's something to always keep in the back of your mind. The way to tell whether or not you really need to take your kid into the emergency room if it's the weekend or nighttime, or to the doctor's office if it's during the week and office hours, is does your kid look really sick?
Okay.
Not just sick to their stomach and feeling crummy, but really sick. Do they look like there's something more than just stomach flu on? That's a gut feeling, and almost every parent has that.
Well, yeah, you know your kid. You know what they look like when they're healthy.
That's the mistake that a lot of doctors make, especially, ER doctors, but even pediatricians. They don't listen to the parents.
Yeah.
And if you don't listen to the parents, you're blowing it.
Yeah.
Because a parent knows their kid.
Yeah.
In a little one, if the stools, first of all, at any age, if the stools have got any blood in it, you go to the doctor or the ER. You don't wait.
Okay.
Or at least you call the doctor and describe what's going on. That's number one. Number two, in a little one, if they put out stools that look more like currant jelly than actual regular stools,
Okay.
that's a big nasty. If you see a currant jelly stool coming out of your kid's bottom, run, don't walk to the emergency room, because that means that their bowel is folded in on itself. It's called intussusception.
Wait, what do you mean like jelly?
It looks like currant jelly. Have you ever seen currant jelly? It's kind of purpley red, greenish purple.
Okay.
And it's jelly-like.
Oh, it's like jelly.
It looks like jelly. It looks exactly. If you see a currant jelly stool, you get to the ER right away, because that means your child's stomach and intestines have folded in on themselves and are cutting off circulation.
Good heavens. Okay.
And it looks like stomach flu, but it is life-threatening.
Okay.
So that's something. A currant jelly stool sends you straight to the ER.
Okay.
Black stools, not just black, but if you've given your kid Pepto-Bismol, that's off.
Yeah.
But if they have black stools and black tarry stools, then you probably need to go to the emergency room, because that could be blood.
Okay.
If they are just looking sicker and sicker and sicker, and the fever's not going down, you need to go to the emergency room, because sometimes they could have either food poisoning that is serious, as opposed to the usual stuff, or they could be having something really nasty, like one of these nasty things. There's things like hemolytic uremic syndrome and colitis and all kinds of nasty stuff. A bacterial dysentery.
Okay.
And that's much more common in the third world, but it's not like it doesn't happen here
Gotcha.
ever.
Okay.
So those are the things that should make you stop and think, this is not just
Stomach flu. Okay.
If you've got high fever, got 104 fever, and a child who looks like they're dreadful,
yeah.
you go to the emergency room.
Okay.
But if the fever's 102 or less, and it goes down with Tylenol, and they're getting the cramps, they've got the usual diarrhea and the pukes, and when they stop puking or stop pooping, they look better, you can wait.
Gotcha. Okay.
Okay.
Is there anything else? We only have about a minute. So is there any others?
Just a word to the wise.
Okay.
And that is, don't be like your pediatrician who, when she went to the ER with a really bad stomach flu, sat there retching her guts out and saying, "Where's the doctor?"
Okay, there you go. All right. Well, thank you, Doc, for
You're
coming on
welcome.
again. Always fun having you on for the Prima Pediatrics Healthcare Hour.
Always, always.
First Friday of the month, so make
Yep.
sure you tune in next
Yep,
week.
and we will come up with something equally fabulous for the next one.
Yeah, absolutely. Prima Pediatrics Healthcare Hour on AM 1220 KHTS. Friday matinee coming up next. Stay tuned.